For this video, we're going to be discussing what's called the 3-month position in the DNS protocols. This is one of my all-time favorite anti-flexion extension maneuvers for the trunk. Very powerful stability builder, especially for lower back pain cases. Now, when we talk about trunk stability, core stability, really the definition of stability is how much force can you resist, not produce. This is meant to be an isometric exercise, but specifically, how well do you resist forces going into extension and flexion through the spine? Now, many cases of lower back pain, think right across here, stem from what's called an antagonist weakness. So we're talking, if it hurts here, problem actually lives here. You live in extension, we need more control into flexion and against extension. So with this exercise, a couple key setup variations that I like to work in with my athletes and my patients. How we set this up, all on the floor. But what you want to do to begin with is get some elevated surface that you can rest your heels on. So get yourself on the floor, on your back like this. Now, one of the most key fundamental cues that I give with my patients and athletes with this is I want you to smash your back into the floor as hard as possible. Now, of course, this is not to reinforce any sort of lifting position. This is just to target the lower ventral abdominal wall, where most people do lack the ability to buffer forces through flexion and extension. So typically what I will have the patients do is take their hands and make their fingertips meet right underneath their lower back, giving them a kinesthetic cue, something to push against. And then what I want them to think is like, okay, I'm gonna try to crush my fingers with my lower back while this exercise is going on. What I also have them do is just go with heel support in the beginning until you get used to activating through this exercise. But peeling back to 30,000 feet, this is all about breathing and bracing. And I'm not talking about breathing into the chest, but breathing into the diaphragm, breathing into the belly with this. So if you are new to this, I suggest going through at least a couple rounds. Take your hands like C's, pinch around the sides of your hips here. Just get used to breathing in this position. Think of this position as like the bottom end of a squat or a deadlift. However, you are now on your back. All gravity and stability requirements are peeled away. So again, take the fingertips, place them underneath the lower back, just above the belt line, and then focus on first smashing the lower back into the floor, and then just get acquainted with breathing into this position. And then you want to brace really hard, like someone's going to punch you right in the belly button. Brace tightly, and then gradually start to remove your heels from the surface that you're on here. Now this is meant to be held in a 90-90 position through the hips. What I mean is 90 degrees at the hips, 90 degrees at the knees. Feet are not touching, and you are actively smashing your lower back and your fingers here. Now, if you feel a shake during this, that indicates a high neural drive factor to this. And what I mean by that is the amplitude from the signal coming from your premotor cortex to these muscles that says go. That intensity dial is now cranked up to an 11 if you feel a ratcheting or shaking sort of contraction. That's what you want to chase here on this. So again, set up, fingertips underneath the lower back, heels are supported, smash your lower back into the floor, gradually remove the support underneath your heels, and hold. Now for how long? That depends on your programming. What I usually recommend for this is at least a 10-second hold, but not just once, done in a shotgun style variety, back to back to back. Usually I like to do 10 seconds on in this position, 2 seconds off. In that 10-second hold, 2 seconds rest. 10-second hold, 2 seconds rest. Now, if you feel pretty good about smashing your back into the floor and it feels very intuitive to you, then what I instruct my athletes and patients to do is to pretend like you're hugging a tree like this. Your arms are essentially just placeholders, but a lot of people tend to grip with their neck and their traps when they're trying to do this to try to pull stability from elsewhere. So if you can keep your shoulders relaxed, keep the back smashed down, and maintain position well through this exercise, this is a much better variation. However, in the beginning, always go with fingertips underneath your lower back. Again, this is the 3-month position.